Thank the organization committee for inviting me to present our work here. This is a wonderful conference, and I'm a little bit nervous because my next speaker is such a good speaker. It was a very excellent seminar this morning. So I will try to do my best to talk about the adipokine. One of the adipokines at the moment we're working on is lipocaine-2. So in this talk, I'm not a clinician, so most of our approaches are using experimental approaches, using animal models, and we start our work from biomarker discovery. So let me just bring all these terms as cardiometabolic risk factors, as you probably already learned a lot during this conference. The cluster of risk factors such as inflammation, high blood pressure, and dyslipidemia, hyperglycemia, insulin resistance, and they all contribute to the development of cardiovascular disease and metabolic diseases. And especially the core feature of this cardiometabolic syndrome is abdominal obesity or visceral obesity. So what's the key roles of obesity during the development of metabolic disease and cardiovascular syndrome? As you know, when during the obese development, the adipocyte the size is getting bigger, but not only the size is bigger, the adipocytes become more inflamed. So there are more macrophage infiltrated into the adipose tissue, and there's increased lipolysis, and also there's a dysregulated adipokine production. Adipose tissue are not only an energy storage depot, it's actually the largest endocrine organ in the body. It secretes various adipokines. These adipokines plays very important roles in regulating insulin sensitivity, metabolism, and cardiovascular functions. And the dysregulated adipokine productions contribute to the pathogenesis of cardiometabolic syndrome. For example, you have just learned leptin from the previous speaker, and adiponectin is decreased in most of the obesity-related medical complications. And today I'm going to focus on lipocaine-2. This is relative new adipokines discovered. This protein is also called neutrophil galectin associated lipocaine. It's a glycoprotein. It's abundantly secreted from adipocyte, and in the circulation, its level is lower than adiponectin, but it's still relatively high. This protein can be stimulated by various inflammatory stimuli, for example, lipopolysaccharide and interleukin-1 beta, suggesting its role in inflammation-related conditions. So we start our work using microarray expression screening in the diabetic and lean animals. We find that this gene is significantly upregulated in obese and diabetic animal. And it can be reversed by anti-diabetic drug treatment, rosiglitazone treatment. We then generate our in-house antibody and establish the ELISA assay for both mouse and human lipocaine-2. As you can see, the serum levels of this protein is significantly higher in diabetic animal and can be reduced by rosiglitazone treatment. And then we applied our assay on clinical patient, human subject. We find that in obese human subjects, both male and female, the lipocaine-2 levels are significantly higher. And then we performed the correlation studies between these protein levels with other cardiometabolic risk factors in 229 Chinese subjects. And you can see the protein is positively correlated with adiposity, correlate with systolic blood pressure, insulin sensitivity, but it's negatively correlated with HDL cholesterol. And in addition, this protein is also correlated with the inflammatory marker, the high-sensitive C-reactive proteins. After adjust for gender and BMI, this protein level is still correlated with fat percentage, the fasting glucose levels, HOMO-IR index, and also inflammatory markers. In a group of patients treated with zoreglitazone, we find that the decreased lipocalin-2 levels is positively correlated with the increased insulin sensitivity and also decreased C-reactive protein levels. So this clinical study suggests that lipocalin-2 can be used as a biomarker to reflect for example, inflammatory status, insulin resistance status correlated with cardiometabolic syndrome. However, we would like to ask the question, is this protein a simple biomarker associated with this cardiometabolic syndrome, or it actually actively play a role in the pathogenic process? So we start our investigation using the mice without lipocalin-2 knockout mice. And then we evaluate their metabolic functions and also cardiovascular phenotypes. So the first part, I'll present our work on the metabolic characterizations. We introduce two types of obesity conditions. One is dietary obesity and the other one is genetic obesity by crossbreeding the lipocalin-2 knockout mice with DBDB genetic obese mice and monitor their glucose levels, insulin sensitivities during a quite long period of time. As you can see, after high-fat diet feeding for 5 weeks, there's a significant difference between the fasting blood glucose levels and also the fasting insulin levels. Similarly, in the genetic obese models, the fasting glucose level and also fasting serum levels are significantly much lower in mice without lipocalin-2. This is a glucose tolerance and insulin tolerance test in these animals, and you can see these animals have enhanced insulin sensitivities as demonstrated by both types of assays from 5 to 6 weeks of high-fat diet feeding. And similarly, in the genetic obese mice, in those without lipocalin-2, the insulin tolerance test and also HOMO-IR index are much better. We then analyze the different tissues and dramatically changed the profoundly different is in the adipose tissue. We find the adipose tissue wet weight are actually increased in lipocalin-2 knockout mice. And if we replace lipocalin-2 protein in these mice, it can significantly decrease the fat mass. And the fat size, you can see here, is also larger in mice without lipocalin-2. Then we analyze the macrophage infiltration and find that although the fat cell size are enlarged, but they are basically non-detectable levels of macrophage in the lipocalin-2 knockout mice. And also the oxidative stress conditions are significantly dropped. So this is another evidence. We measure the tumor necrosis factor alpha expression in the adipose tissues and find that basically under both aging conditions and also dietary obese conditions, the TNF-alpha levels are significantly lower in mice without lipocalin-2. So to further elucidate the underlying mechanism, we adopted the lipidomic approach to analyze the different fatty acid compositions, and then we find that one of the fatty acids, arachidonic acid levels, are much higher in high-fat diet-fed animals, and in mice without lipocalin-2, this fatty acid is even more higher, suggesting its metabolism might somehow decrease. Then we analyze the downstream metabolite and find that one of the metabolic pathways mediated by 12-lipoxygenase is is less active in mice without lipocalin-2. And you can see one of the metabolites, the 5-HTE levels is much lower in mice without lipocalin-2. And the enzyme levels, the 12-lipoxygenase responsible for this metabolic pathway, is also much lower in mice without lipocalin-2. And if we replace this protein into the animal, it can rapidly stimulate TNF-alpha production, stimulate the metabolic pathway of 12-lipoxygenase, and generate more the metabolite. So in these studies, we measure the blood pressure of these mice. As you can see, the high-fat diet feeding increased blood pressure in wild-type animal, but compared with the standard true-fat animals, the blood pressure in lipocalin-2 knockout mice essentially not changed too much. And this shares very similar patterns of the lipocalin-2 expression levels in adipose tissue and also circulating levels. High-fat diet can dramatically increase lipocalin-2 production from the adipose tissue. And this is the result of vascular relaxation induced by insulin. So we take the aorta tissues from these animals and use the tissue micrograph to evaluate insulin-evoked vasodilation. And this is a presentation of area on the curve. As you can see, as the mice getting older, the insulin's capability to stimulate aorta relaxation is gradually decreased. And high-fat diet significantly accelerates the deduction of insulin responsiveness. As you can see, only 2 to 3 weeks high-fat diet, there's a significant decrease of insulin-induced vasodilation. And on the other hand, in mice without lipocalin-2, the insulin sensitivities in this aorta tissue are much higher. And this is the Western blot image to evaluate the signaling pathways downstream of insulin in these aorta tissues. As you can see, the phosphorylation levels of eNOS and also phosphorylation levels of ACAT are significantly higher in mice without lipocalin-2. And we also evaluated the eNOS uncoupling. As you know, the eNOS dimer is the active form, and uncoupled eNOS is inactive form. And in lipocalin-2 knockout mice, there's essentially non-detectable levels of eNOS dimer monomers. This is a result of the nitric oxide bioavailability, so it basically reflects the eNOS activities, and we find the NO bioavailability is much higher, both basal level and also after insulin stimulation. And the nitrosylated protein levels is also lower in the aorta tissue of lipocalin-2 knockout mice. So we then carry on using another type of blood vessel, the artery, is a carotid artery, to evaluate whether there's any difference of endothelial-dependent contractions. This is also one of the mechanisms underlying hypertension. And then we find that the endothelial-dependent contractions can be induced by both aging and high-fat diet. Again, high-fat diet accelerates the damage of the endothelial cells. And on the other hand, in mice without lipocalin-2, the endothelial-dependent contractions are very low. So this experiment is just using different pharmacological inhibitors to evaluate which pathway might be involved in there. And in particular, we find that the COX-specific inhibitor, COX-1-specific inhibitor can attenuate endothelial-dependent contractions. And here, we use Western blot and qPCR to evaluate the COX-1 expressions and find that in lipocalin-2 knockout mice, COX-1 expression in carotid artery is much lower and cannot be induced by high-fat diet feeding. And then we replace these animals with lipocalin-2 protein acutely, and we find there's a time-dependent effects of lipocalin-2 to attenuate insulin-dependent relaxation and also to enhance endothelial-dependent contractions. And the protein treatment also caused a significant elevation of enos monomer content, and also COX-1 expression level is higher. So in summary, this work suggesting that lipocalin-2 in vascular system, it can inhibit nitric oxide synthesis activities and stimulate cyclooxygenase productions, therefore cause decreased NO bioavailability and increased endothelial-derived contracting factor production, therefore cause endothelial dysfunctions. So from all these studies, although we are still not quite sure the detailed molecular mechanisms underlying lipocalin-2's effect, we think there are two major streams that converged. One is lipotoxicity and the other one is inflammation. This protein is a family of lipocalins, and these are the lipid carrier proteins. So possibly lipocalin-2 can acting as both an inflammatory regulator and lipid carrier to stimulate the lipotoxicities and to enhance chronic inflammatory and therefore cause insulin resistance and endothelial dysfunction to contribute to the development of cardiometabolic syndrome. So this is just a slide showing our work during the past 10 years. We have used our work with proteomic genomics-based novel biomarker discoveries, especially focusing on adipokines. And then once we find the potential candidate, we use clinical samples to validate our findings and then generate proteins for functional analysis and also assays for clinical validations. And then this is the basic strategies of our group. And during these strategies, we have successfully identified a number of different adipokines and are carrying our work on each individual adipokines. Here, I would like to thank all my colleagues, especially Dr. Aimin Shi, Professor Karen Lan, and Professor Wang Hu's group, and they have helped on various aspects of this work. And most of the metabolic studies are carried on by Dr. Ivy Lau, who is just graduated, working in UCLA, and the endothelial function studies are